Hello everyone, once again welcome to my Oet channel. Today I came with Oet letter introspection of the exam date 24 June 2023. So fortunately, actually we got today's letter. It was very easy because recently only I have posted the same question paper in our WhatsApp group. It's for my students, and this question paper actually which got published in 2018, and we could see that when my students they replied me regarding the follow-up of the exam. So it was very surprisingly that it is almost same question paper, but only there they have given some additional points in this question paper. So I have the question and I will share it with you, so it will be easy for the upcoming students to prepare for your exam. So one thing actually I want to tell you that nowadays they are asking more or less same question papers from 2017, 18, 19 and 2020. The writing letters are mostly they used to take from the content will be same like previous exam question, but the reader will be doctor, either doctor or nurses. Okay, before and all we had many type of readers, but now in this year they are asking only to the doctor, and mostly it is noun case to patient's GP only, okay, or patient's family doctor. So today's letter also it is towards families, towards patient's family doctor. So it is a noun case actually, and I will share with you the question. And today's video I will just tell you how will be the letter, and next video I will post the original question paper with, I will attach the question paper and with the sample letter. Okay, so the thing is actually it is not same like today's exam question, but 90% it is same. So we can see that you are a nurse in Nurseland Outpatient Clinic in Newtown Hospital. You taking care of Mr. Pittman. Okay. Name of the patient is here. Actually, it is our old question paper. It is given Mr. Walter Pittman, but I'm not sure about today's exact name. But it is Pittman only. Then age is 69 years. Family is married. Has 2 children. Job is retired accountant. Habits they have given no smoking or alcoholism. Sedentary lifestyle and no exercise. Past history is hypertension since 2008 and overweight. Admission date is 1/7/2018. Actually, they have given in this question paper. Discharge date is 3/7/2018. So actually, in our question paper, the today's date is 8 January 2023. So the admission date may be 15 days back of this date. Okay. And another one more important thing, patient already has hypertension since 2008, but they didn't give any medication name and all. And patient history, the current history is, present history is accidental cut injury when using handsaw for cutting wood. Referred by family physician for further care. So this is the same doctor, and brought to Newtown Hospital with a deep lacerations on lower left arm. On admission, so whatever the management they have done is wound cleaned, sutured and dressed well. They have started prophylactic IV antibiotics and the course has completed. And on the next day they have stopped IV antibiotic and they have started oral antibiotic and regular dressing also. But they have noted one thing, patient's blood pressure, it is somewhat high, 140/90 mmHg in sitting position and 180/90 mmHg in supine position. And on the next day patient got discharged, advised visits to Nurseland Outpatient Clinic, that is our clinic. Then on the next day, patient visited in our clinic and he had severe pain and hematoma on the affected arm. So what we did, we have done the dressing and we sent the patient, but at that time the blood pressure was still it was high, 186/89 mmHg and 190/86 mmHg in sitting and supine position. And on 6/7, that is after 3 days, he revisited with a better healed wound. So we have done the dressing, but still the blood pressure is keeping on high. Then the previous day, actually 2 days before, wound dressing done, the healing was good without any infection, and blood pressure is still elevating, the same thing only they have given repeatedly. And today, actually today's visit, wound healed well. Blood pressure is 190/84 mmHg in sitting and 196/86 mmHg in supine position. Assessment revealed BP elevated, which because already patient is a hypertensive patient and is suspected to have orthostatic hypertension. So this is actually our condition, that is suspected case. So the plan is cardiac assessment for hypertension and family physician referral. So that is what we are going to write. So the thing is, patient is suspected to have orthostatic hypertension, and we are referring the patient for cardiac assessment. Okay. The writing task they have given that write a referral letter to the family GP, Dr. Lacrizel, Newtown 2137, asking him to do a full cardiac assessment and management of Mr. Pittman's hypertension. Okay, so we are asking the assessment, cardiac assessment, and further management for this rising hypertension. Actually, there will be a little confusion, family GP, whether it is non-case or unknown case, but it is clear in our case note that this is the same doctor only referred the patient before. So it will be a non-case only. Okay, so this is a simple question paper. I think in today's case note, they have added some more points. I don't know. I'm not sure about those points and all. But almost the case note is only this is the thing. Okay. So with this, we can formulate how we can formulate effective letter. Okay, just I will give a quick recovery, and in my next video you can see exactly how will be the letter. So don't forget to see that next video also. Okay. So anyway, we will start with that. So I hope the date is 8 January 2023, and the address is Dr. Lacrizel. The name of the doctor will be different. Family doctor, Newtown 2137. So address may be different. Okay. Then we'll start with the dear Dr. Lacrizel regarding Mr. Walter Pittman. As I told you, the name will be different, but it's Pittman. Age is 69. Age is same. So our introduction will be, I want to tell you that in this case note we have two conditions. So you may think that only we have to write suspected orthostatic hypertension. No, actually you have to see the current status. Okay, current status means patient is recovering. Even they wrote that recovered, but it's not completely recovered, right? So still patient is coming for like follow-up visits. So we have to write both category and hypertension. Okay, so the introduction will be, this is a noun case, so in introduction should be in the same format. I'm writing to update you the current health status of Mr. Complete name you have to write here. It is Mr. Walter Pittman, who is recovering from cut injury in lower left arm and suspected to have orthostatic hypertension. Okay, he requires further assessment and management. Some students, they used to write completely the same requirement in introduction, like he requires cardiac assessment and management for hypertension. Never do that, because you will lose the exact recommendation, and you could not write the same sentences in recommendation paragraph. It will be repetition and you will lose the mark. So introduction, you can just write a sum up like a concise form. Okay, so I'm writing to update you the current health status of Mr. Walter Pittman, who is recovering from cut injury in lower left arm and suspected to have orthostatic hypertension. Okay, he requires further assessment and management. That's enough. Then we will go to the present medical paragraph. As you know that it is a noun case, actually no need to write anything regarding the past history, but if you want to write only the visit, what are the things that's happened during our visit, the letter will be very small. You could not write even 140 words. It should be minimum 180, right? So we have to mention some points in the first paragraph. It's just like a concise one, but you have to start with as you are aware. Okay, if you didn't use that term, it will be like a unknown case. So what you can write, as you are aware, Mr. Pittman was admitted in the hospital on that date. You have to write, okay, admission date. I assume 25 December 2022, following an accidental cut injury with deep lacerations on left arm, comma, for which he was managed conservatively. Like that also you can write, or else he was managed with the suturing, dressing, as well as prophylactic antibiotics. It's your choice. Okay. Then during hospitalization, he was noted with elevated blood pressure such as 140 by 90 mmHg and 180 by 90 mmHg in sitting and supine position respectively. Then you can write, since he is hypertensive, since, and I have given the year since 2000. I don't know in our letter what is the date or year they have given from when this patient have hypertension, but in this case not, actually this patient have hypertension since 2008. Okay, that means 10 years before. So 10 years patient is on patient has the problem. So what we can write here, since he has had hypertension for the past 10 years, follow-up arrangement has been follow-up visits has been arranged for his wound and hypertension. Okay, or wound and blood pressure monitoring. like that we can write. Then like that also he can write, or else he can formulate like this: gradually he was discharged after 2 days with the arrangement of follow visits at our clinic, since he has had hypertension for the past 10 years and for the follow-up of his cut injury. Okay, like that also you can write in that paragraph. So once again I will read for you. As you are aware, Mr. Pittman was admitted in the hospital on 25 December 2022 following an accidental cut injury with deep lacerations on left arm, for which he was managed conservatively with a suturing dressing as well as prophylactic antibiotics. During hospitalization, he was managed. During hospitalization, he was noted with elevated blood pressure, such as 140 by 90 mmHg and 180 by 90 mmHg in sitting and supine position, respectively. Then you can write, gradually he was discharged after 2 days with the arrangement of follow-up visits at our clinic, since he has had hypertension for the past 10 years and for the follow-up or review, or you can write like review dressing or follow-up dressing or further dressing. So for further dressing of his wound. Okay. Then the next paragraph, this is already the most of the things already the reader knows, and the second paragraph is the important paragraph what we noticed during his visit in our clinic. This paragraph should be highlighted. Okay, highlighted means we have to stress. Subsequently, during Mr. Pittman's visits, he was noted with mild hematoma and pain, however, which got subsided over the time period. Okay, within one sentence we can conclude this point. That even though his blood pressure remains elevated, today his visit revealed well-healed wound without any infection. However, his blood pressure is noted 190 by 84 mmHg in sitting and 196 by 86 mmHg while supine position, which aroused the doubt of his possible diagnosis. So this particular sentence you have to practice well, because it is something different. When you are writing in such way, your letter will be unique. Okay, so this sentence you can use it only for suspected cases after the clinical features. Therefore, your expertise service is beneficial for his well-being. So that is only the paragraph. Here we have sum up everything. Okay, what are the things we noted during the visit, including today's visit. So subsequently, during Mr. Pittman's visit, he was noted with a mild hematoma and pain, however, which got subsided over the time period, even though his blood pressure remains elevated. Today, his visit revealed well-healed wound without any infection. However, his blood pressure is noted 190 by 84 mmHg in sitting and 196 by 86 mmHg while supine position, which aroused the doubt of his possible diagnosis. Therefore, your expertise service is beneficial for his well-being. Then, social paragraph noted because it is a noun case, and we will go to the last paragraph. Actually, last paragraph, as you know that we request only cardiac assessment and further management. We can write like this: it would be appreciated if you could take over the case of Mr. Pittman to evaluate his cardiac function for elevating blood pressure and provide specialized intervention as you feel appropriate. Okay, so within one sentence we can sum up: it would be appreciated if you could take over the case of Mr. Pittman to evaluate his cardiac function for elevating blood pressure and provide specialized intervention as you feel appropriate. And please feel free to contact me if you have any queries. Yours sincerely, registered us. Okay, so this is the letter, and I hope I have included all points, but I don't know if anybody, those who attend exam today, if you notice anything missing, you can just message me in my WhatsApp, or else you can just drop a message in the comment box. Okay, so that I will add in the original letter. So I hope this is enough for our letter, because in the second paragraphs and all we have to sum up, because there is nothing more in the visits and all. Only the thing, patient's injured part, it got well healed, and the BP is getting increased. Last blood pressure value we have to mention clearly. Remaining everything is okay. And so most students, they used to avoid that first paragraph what I told you. As you are aware, we could not avoid in such case, not because it is small letter. Only visits are there, many visits are there, but only the content is very little. In such cases you can write something, but don't forget to use as you are aware. Okay, but that paragraph should be small and whatever things we have mentioned, it is like a sum up only. So it's okay, fine, no problem. So minimum 180 should be there in our letter, because social paragraph is not there. Last recommendation paragraph also only one sentence will be there. So we have to write something else to make the letter somewhat bigger. And if you are using as you are aware, the phrase as you are aware, it will not affect your mark, because in my exam also the question paper was, it was like this noun case, so I wrote in the same way, so no problem. So I hope this explanation is beneficial for you. So just try to write down your answer in a book and practice well. And you can practice many noun case, because nowadays they are asking many noun case letters, like alternatively noun case or non-nurse, then again noun case nursing home. So in this year we could see that many noun case letters are there. So practice many noun case letters, and if you want to see how to write the noun case letter, you can see my YouTube playlist. In that playlist, separate folder is there for noun case. You can see that, and there is a introspection playlist also is there. In that you can see all relevant question papers and introspections, everything. Okay. And another one more thing I would like to tell you, that if you have enough time for practicing, and if you have difficulty in writing module, I have a book. It's a pro guide, an ultimate pro guide for writing, in which I have given some Oet grammar, all basics in writing letters, all basics from A to Z letter writing, and I have included 25 recent exam question paper plus sample letters, and 50 older type of letters. From that older type of letters only now they are asking the question. So this guide will be very much beneficial for you, I hope. So total 75 question paper as well as the sample letters. It's my sample letters are there. So it made very easily. It is, everyone can understand, even the beginners can understand the letter writing if you read that letters and all. So if you want, you can just drop a message. I will keep the number in the description box, the WhatsApp number, so you can contact in that number. And inside India we can send it free of cost, and the guide rate is 3000 Indian rupees. And inside, as I told you, inside India we can send it free, but if you are in any other country outside India, the courier charges are applies. Or if you have any friends in India currently on vacation, I can send to them, so that at least they can bring to you. It will be nearly 1.4 kg weight, so you can just ask to your friends, and if it is okay for them, of course I can send to them. Within 3 days they can get it by courier, professional courier. Okay, so if you need it, you can just message me. And if you have any queries regarding the questions, you can drop the message in the comment box also. So I hope this video is helpful for you. We will see with another one informative video, and don't forget to see the next video. I will post the question paper as well as the sample letter. We will see with another one video. Until then, bye, take care.